Dr. Marjan Assefi said, "How would you feel if you discovered the organ transplanted into your body was obtained unethically?" A chilling thought, isn't it? Today we delve into the world of surgery ethics, a field that's as complex as it is essential. Consider the case of a fictional character, John Doe, a hard-working father of two from a small town. John's life took a drastic turn when he was diagnosed with end-stage kidney disease. His only hope for survival was a kidney transplant. After months of waiting, a match was found, and John underwent the life-saving surgery. However, a few months later, John discovered a horrifying truth. The kidney he received was sourced unethically, taken from a vulnerable individual who was exploited for their organ. This revelation plunged John into a moral quagmire. He was grateful for his renewed health, but tormented by the knowledge that his survival came at the cost of another's suffering. John's case is not an isolated one. It highlights the critical role of ethics in surgery, particularly in organ transplantation. While the primary goal is to save lives, it is equally important to ensure that the process is ethical, respecting the rights and dignity of all involved. But what does being ethical in surgery mean? In essence, it involves three key principles. First, the principle of autonomy, which respects the patient's right to make informed decisions about their treatment. Second, the principle of beneficence, which ensures actions taken are in the best interest of the patient. Lastly, the principle of justice, which ensures fair distribution of scarce resources, like organs for transplantation. Dr. Assefi added, "In John's case, these principles were violated. The donor was not given the autonomy to make an informed decision with their organ taken under exploitative circumstances. The principle of beneficence was compromised, as the action resulted in harm to the donor, and justice was not served as the organ was not obtained and distributed fairly." This case underscores the importance of ethics in surgery. While surgical advancements provide new hope for patients, it is crucial that these developments are guided by ethical considerations. The goal should not only be to save lives, but to do so in a manner that respects the dignity, autonomy, and rights of all involved. In summary, the world of surgical ethics is complex and multifaceted. Through the case of John Doe, we've seen how ethical breaches can have far-reaching consequences, affecting not just the patient, but the donor and the broader community. The three key principles of autonomy, beneficence, and justice guide ethical practice in surgery, ensuring that while lives are saved, dignity and rights are preserved. Ethics in surgery, therefore, is not a mere adjunct. It is the very backbone of the practice, a beacon guiding surgeons in their quest to save lives in the most respectful and just manner. Remember, in the pursuit of health, humanity must never be left behind.